Now, let's discuss centrally acting muscle relaxants in a clinically integrated manner, combining their important features, duration of action, uses, and adverse effects. Centrally acting muscle relaxants primarily act on the brain and spinal cord to reduce muscle spasm and spasticity without causing complete paralysis, and they are widely used in conditions like multiple sclerosis, spinal cord injury, and acute musculoskeletal disorders. Let's start with baclofen, one of the most important drugs in this group. Baclofen acts as a GABA B receptor agonist at the spinal cord level, reducing excitatory neurotransmission and muscle tone. It has a moderate duration of action and is particularly useful in chronic spasticity such as multiple sclerosis and spinal cord lesions. However, its adverse effects include sedation, dizziness, and muscle weakness, and importantly, abrupt withdrawal can lead to severe rebound spasticity, hallucinations, and even seizures. Next, diazepam acts by enhancing GABA A receptor activity, producing muscle relaxation along with anxiolytic and sedative effects. It has a relatively long duration of action due to active metabolites. It is useful in acute muscle spasm and conditions like tetanus, but its major disadvantages are excessive sedation, dependence, tolerance, and respiratory depression, especially at higher doses. Now moving to tizanidine, which acts as an alpha-2 agonist in the spinal cord to reduce excitatory neurotransmitter release. It has a shorter to intermediate duration of action and is useful in spasticity with relatively less muscle weakness compared to other drugs. However, it can cause sedation, hypotension, dry mouth, and hepatotoxicity, requiring monitoring of liver function. Another commonly used drug is cyclobenzaprine, which acts centrally to reduce tonic somatic motor activity and is mainly used in acute musculoskeletal conditions. It has a relatively long duration of action but causes marked sedation and anticholinergic side effects like dry mouth and confusion, especially in elderly patients. Orthocarbamol and clozoxazone are other centrally acting agents with moderate duration, used for acute muscle spasm, and they generally cause mild sedation and dizziness. So, if we compare, baclofen is best for chronic spasticity but has withdrawal risks. Diazepam is effective but highly sedative and dependence forming. Tizanidine offers a balance with less muscle weakness but causes hypotension, and cyclobenzaprine is useful for acute spasm but has anticholinergic effects. In conclusion, centrally acting muscle relaxants are preferred for spasticity and musculoskeletal conditions because they reduce muscle tone without complete paralysis, but their use is often limited by sedation and CNS-related adverse effects, making drug selection dependent on patient condition and clinical need. Thank you.